Good evening.
Good evening, everyone, and welcome to the Dearborn Lions Club second COVID-19 panel discussion. And prior to proceeding with this evening's discussion on COVID-19 and its impact on our communities, I felt it was very necessary to take this opportunity to send prayers to the victims of war, and especially those that have lost their lives recently in the Middle East. Today, we are honored to host a distinguished panel of clergy, religious leadership, law enforcement, and mental health professionals. And in these times of crisis, people turn to these voices of reason and compassion. Today, we have all those voices. We cannot but mention the tragedy that has taken place in the Holy Land and Gaza. Men, women, and children losing their lives, shelter, and livelihood is a human rights tragedy and injustice. The world cannot stand idle and watch. We cannot stand idle. We cannot be selective in our pursuit of human rights and human dignity. We hope and pray for a just and equal peace and hope that those who have a place at the table will proceed in that direction. Please join me in a few seconds of silence for those who have tragically lost their lives and who are victims of war. We pray the world soon finds lasting peace. God bless you all, and God bless the voices that will lead us to peace.
Inshallah.
Inshallah. Amen. Good evening and welcome, everyone. My name is Siham Awada Jafer, and I'll be moderating tonight's discussion. Welcome to the second Dearborn Lions Club COVID-19 coronavirus panel in partnership with DMC and Access, focusing on safety in the age of COVID, mental health, and a conversation with our faith-based community. How are we coping? How is the faith-based community providing comfort to their constituents while adhering to CDC guidelines and the continuing changing platforms? And in this economically challenging environment, is our safety at risk? And how is our law enforcement agencies addressing the added strain? These topics and more are on our agenda this evening. And prior to our anticipated conversation, I'd first like to collectively welcome our panelists and thank them for being here, and currently would like to introduce our president of the Dearborn Lions Club, Lion Ali, to get us started this evening. Ali?
Thank you, Siham. Thank you. I want to thank you all for coming here today. I want to apologize for a quick later start due to technical difficulties. I want to thank the Lions Club team for helping and supporting this project. Lion Jamal Dakroub, Fatma Mustafa, Fuad Ashkar, Samir Alabi, Ronald Coleman, and of course, Siham Jafar. And I want to thank the panelists that agreed to be on discussing our topics with us today. Rabbi Dorit, Chief Ron, Dr. Barlow, Father Shelhoub, and Imam Kazaruni. Throughout the panel, if anybody has any questions, feel free to submit them in the chat or in the Q&A section down below, and we'll have a time slot in the end where we will be addressing questions from the participants. With that being said, thank you all for joining us, and Siham, throw it back to you.
Thank you, Ali. And on behalf of our partners, DMC and Access, we want to welcome our esteemed panelists and thank them for investing their time and expertise and joining us for this crucial conversation. I'd like to introduce everyone. We have Dearborn Chief of Police, Ron Haddad, who's been recognized on numerous occasions for his handling of many crises that he has effectively addressed, and none of the least is the COVID-19 crisis. He has been the City of Dearborn Chief of Police for 14 years and has served in law enforcement for 48 years. Last year, Dearborn Mayor John D. O'Reilly Jr. tasked Chief Haddad to lead the city's COVID-19 initiatives. Welcome. We also have with us Imam Ibrahim Kazaruni, and he's found his home at the Islamic Center of America in Dearborn, Michigan. He's also an adjunct faculty at the University of Detroit Mercy and a fellow at the Center for the Study of Human Trafficking. He has taught comparative religious studies at the Foundation of Islamic Law on Human Rights, and Dr. Kazaruni is the recipient of many awards, way too many to mention this evening, for his bridge building and peace initiatives. Among us all, he was also honored with Congressional Record for working to end the war in Iraq in 2004. We want to thank him and for being with us this evening. Father George Shelhoub, someone very near and dear to everyone's heart, is the senior clergy at the Basilica of St. Mary's in Livonia. They moved to their new home in 2002, which is St. Mary's house of worship, the Basilica of St. Mary Antiochian Orthodox Church, where Metropolitan Philip proclaimed it a new church for a new century under the leadership of Father George Shelhoub. He is an associate professor of religious studies and philosophy at Madonna University, and he has led his parish with pride, integrity, and a strong sense of compassion. Welcome, Father Shelhoub. Rabbi Dorit Adut, a dear friend who I've worked with on many occasions, is a rabbi without borders and was ordained from the Academy for Jewish Religion in New York. She's done rabbinic work and spiritual counseling. She's actively involved in the revival of downtown Detroit and bringing together interfaith leaders in the Metro Detroit area. We also have with us Dr. LaSonia Barlow, and she's a certified forensic psychologist, psychotherapist, and grief counselor at Healing Waters Grief Therapy, where she specializes in incorporating biblical scriptures and medical treatment to help restore a patient's mind, body, and spirit. Very much looking forward to engaging Dr. Barlow. Welcome, panelists, and thank you all for joining us this evening.
Thank you.
Thank you.
Welcome, welcome. So I first and foremost would like to start with Chief Haddad. Our national narrative has been extremely challenging in regards to law enforcement, and given the pandemic and the challenges faced economically, socially, and personally speaking, start us off with how you've adapted to the policing in this age of the pandemic, and also trying to keep law and order and addressing the safety of your officers and the safety of the community. I know that's a loaded question.
It's a complex question. Good evening. It's a pleasure to be with you, Siham, and our distinguished panelists as well. Let me tell you that in the beginning of 2019, I looked at youth suicide, which was at a 20-year high and kind of under everybody's radar. And I looked at our opioid crisis that was going absolutely through the roof. And I thought that those would be the two biggest things we'd have to contend with in 2020. And then COVID hit. Somewhere about the 27th of January, I saw it on the USA Today on the front page. They're really talking about Kobe Bryant. And they mentioned something about this virus. So I discussed it with the mayor, and he assured me it was something very real that we needed to get busy on. And then, I don't have to tell anybody on this panel, George Floyd happened in May. Again, it just made our world so complicated. You mentioned the word adapt. We had to adapt daily with changes. Law enforcement, people were staying at home. Initially, they seemed to meet it with patience and perseverance, but that soon wore off. Our business sectors changed dramatically in how we used to service them. Schools were closed. So in the police department, we totally changed how we, provide our services to the community. And having said that, we found ourselves preparing for something that we never could, prepare for in the past. We really took a lead in rapid testing for our community early on, and we ultimately tested right here at the library over 30,000 people for COVID. We partnered with all the business entities to deliver food to seniors and others. Here in the police department, we had to adapt to make sure that we keep our men and women safe. I initially, before all the masks came out, I ordered that everybody shave so that we can wear our respirator N95 masks. And so we quickly adapted. And crime last year was 16% down, with the exception of guns. It almost doubled. And domestic violence, and we've talked about that in the past. So all in all, I would say that our community fared fairly well, but not without challenge.
Absolutely, absolutely. And we're going to come back to you on a few of those items. But I wanted to also address that we brought you together because really it's mental health, it's faith, and it's safety. And all of you represent those things. But Father George Shalhoub, how has the pandemic affected the faithful, and how did you reach out during a time when support and faith-based guidance was more needed than ever, and yet those challenges where people could not be together, and a lot of individuals don't use Zoom, they're not
The
technically
hardest thing
oriented.
was this self-imprisonment and isolation and lack of social connectedness. So we have utilized in our community many forms of communication. We called, we have Zoom service, but above all, we broke it into committee to check on everyone. If somebody's sick, somebody need help, if somebody is in crisis, we refer to them to a professional. And this connectedness made us survive the entire pandemic. But it was, if to say the least, it was not frightening and depressing. It will be understatement. It was frightening and depressing. But study shows that people of faith and community of faith, they lean on each other. And so we start having an outreach program, whether to feed the hungry, whether to check on the people. And we received so many equipment such as sanitizer and mask, and we share it with everyone. We share with food, but the point is we checked on each other, and I think that does, because especially with immigrant community, usually they're very private. They did not want to expose themselves. But when they hear from the priest, from the deacon, that we love you and we are praying for you, and I communicate with them through the live streaming twice a week, and they felt a sense of a community. So that's what made us. Did we lose people? Yes, we did. We lost so many people to this COVID, and we lost founders of our community, and Deacon Isa, whom the whole community knows. It was very devastating on all of us. But again, people of faith rely on hope, rely on love, rely on each other, that these things may not last forever. It's only passing. And when you think of what our people going through back home, it's like a picnic. So
Yes, comparatively
we get with
speaking.
the program. Don't feel victimized and feel sorry for yourself. Be strong, stand up, and be counting, and reach out to others.
Absolutely. And I think that's the key, reaching out to others and reassuring people that we are in this together.
Yes.
Imam Kazaruni, I would really relay that almost the same question to you. And I know that, Zoom is an extremely challenging thing. So how have we been able to connect with the community to be able to reach out and have that conversation on faith and guidance and, togetherness and connectivity without losing that spiritual positiveness that we all need during this incredible time?
Well, Siham, during ordinary times, faith-based organizations and religious leaders play a critical role in time of crisis in bringing hope to the community. But unfortunately, I have to admit, similar to what Father George talked about, the characteristics and as well as Chief Haddad, the characteristics and the suddenness of this outbreak, particularly at the early age, where we had no proper strategy how to deal with it, or even little information available, led us to go through a number of phases. The initial phase, it was what I call the phase of paralysis. Literally, when the center was closed, there was no access to anything. The old mode of communication and communicating with the community was no longer valid, which was face-to-face, going and visiting them. So we had quickly to adapt to new phases. The students that I teach, they came to my assistant, they provided the Blue Jean pages, Zoom pages, which I had to begin to learn how to kind of grapple through this, or even call it, for me initially, it was a minefield trying to navigate through it. One of the primary issues at the beginning was how to communicate with individuals. When the center was closed, people were not allowed to come to the center. And not everybody knew anything about Zooms, Blue Jeans, or anything else. So the only thing I could do at the early stage was to pick up the phone and literally call people one by one. Are you okay? Do you need any help? Is everybody within the family okay? If I knew somebody, if I didn't get any response from them, then I would ask people who are living within the neighborhood, can you call and check so-and-so? I haven't heard anything from Mr. So-and-so, sister so-and-so. So that was during the paralysis time, the only way, the crude old method of communication. But as time went on, we began, and the information became available, we began to really become more active, and various methodology was used in the social media, etc., that we were able to communicate with others. Our program lectures went immediately to Zoom and Blue Jean and social media. The communication, we asked people to go through Facebook and other sources to be able to communicate with us. One of the fundamental challenge early on was what we call the line between what religious leader or faith-based organization or services that we provided and other institutions provided. That line immediately was negated and no longer active. So people came to us and asking us to provide services, particularly during the second phase, that it wasn't originally or traditionally part of what Islamic Center or faith-based organization could provide. That's why I had to go to a number of other organizations and ask for assistance. Please, can you help us here? Chief Haddad talked about suicide, opiate, and domestic violence, which was something that we cooperated with each other. But suddenly we found out that these are not the issues anymore, and we really needed the expert opinions people. Gradually, this moved into the third phase, where, thank God, the situation kind of with the appearance of vaccination and everything else, things settled down. But the major thread, I want to echo what Father Shalhoud talked about, that major thread that went through all of these three phases was how to keep in contact with the community and provide hope so that they don't become despondent and lead to other crises. And I hope that we will be able to even succeed better.
Absolutely. You put that very, very relatively in terms of having a different service description. I think we became more than just the spiritual guidance. People were looking for mental guidance, for services guidance, for nutrition, for everything, and going to their faith-based communities to do that. So, and that takes me to Rabbi Dorit. Rabbi, you work with the interfaith community, so you sort of have a pulse on, you know, how everybody was working things and how they were reaching out. So with your experiences, how did the faith-based community come together as an interfaith community and reach out to those individuals? And were there cross-referencing in terms of, you know, this community has these kinds of services sharing with, you know, others, and how did they all come together as one, basically servicing all the multiple communities of faith?
Well, thank you. I'd like to first say that the Jewish community, also very similar to what Imam and Father have said, we were just also taken for a loop. The one thing that was in place that really did help us, we have an overarching organization called the Jewish Federation, and they had set up something already before the pandemic called J Help. It was a website and a phone number where you could call to get multiple kinds of services. And this became kind of a lifeline for a lot of people. It connected them already with food banks, with housing, with jobs, with mental and spiritual help. In addition, there was something that a number of the rabbis and chaplains got together to create called Ruach, to support people where they could call in and have within 30 minutes have someone call them. So we were lucky that way. However, I have to say, from the meetings with the boards of rabbis and other, we were all taken by surprise. How do we keep our congregations together? None of us knew anything about the Zoom, live streaming, Facebook. We have learned so much in this past year. And now they're actually talking about the fact that we are probably going to have hybrids in the future where you have part of the congregation is always going to be live streamed or on Zoom and part will be in person. So some people just, it's more convenient for them. Plus you get to visit congregations all over the country, all over the world this way. So that's pretty
Absolutely.
fantastic. Yeah.
Absolutely.
The interfaith community also, it's been a big shock, but we have been trying to work together to coordinate, especially our work in Detroit, with helping the schools and helping various services that are provided to people there. And I have to say that communications is key. We've had so many Zoom meetings just to keep in touch. And I prefer calling because I think too, my Dion group, Detroit Interfaith Outreach Network, right away, we called all our members to find out how are they doing. We have over 300 people who from various faiths. How are they doing? Do they need any help? If so, we right away got back in touch with them and were able to direct them to various places. A lot of people who lost jobs, who lost houses.
Family
And
members.
yeah, and the hardest thing, I guess, for all of us, maybe you're going to ask this question, was the funerals and those who were sick, not being able to be with them. That was just incredibly hard.
And we do want to talk about that in a little bit as well. So I thank you, Rabbi Dorit. I want to go to Dr. Barlow. The mental health is then something that is definitely has affected almost everyone. I can't imagine anyone, you know, coming out of this, you know, as we went in, as Father Shalhoub talked about in terms of isolation and being depressed and not having that connectivity again. So I know that, you know, I had read that you do use, the spiritual kind of communication and, the biblical scriptures, if you will. So integrating them in your healing and treatment process. So how do you integrate that, and how does that create that, the mental capacity to be whole again, I guess, if that's even possible?
Well, it's a process to be whole again, and you're absolutely correct about that. From the spiritual standpoint, it's the foundation. So that's my root, that's my foundation. So I kind of build upon that from a clinical aspect. And we use those together to heal the individual through the process, because it has been very traumatic for everyone, the events that has occurred last year and this year as well. So we kind of integrate that together, the spiritual and the clinical aspect.
So how do you, if you have individuals of different faiths, how do you address that?
I meet them where they're at as far as their faith and their belief system. We discuss that and we build upon that. Individuals from different faiths, that's kind of what we deal with.
Thank you. So I want to go to Chief Haddad once again. Law enforcement agencies don't close their doors. So how difficult has it been for your police officers to maintain law and order while taking into account protecting themselves from the invisible enemy that has killed millions around the world? And also, I know that you have dealt with the protests that have been occurring. That in itself is a challenge, but the protests and COVID-19 and the spread with many individuals, not social distancing, of course, as we've seen, on media worldwide, and having to keep law and order and staying safe yourselves. How has that sort of been interpreted in this day and age of COVID?
And it's a highly complex question you asked there. But first of all, we worked very hard to ensure our officers' safety, and we trained hard. We made sure that we kept them as sterile as we could keep them, and keep them in an environment ready to serve our community. So we had to keep them safe. With the protests you mentioned, those were quite challenging. Philosophically, I believe that you let people exercise a First Amendment right so long as it's peaceful. It doesn't infringe on the rights of others. It doesn't erode the good quality of the community. And so that took us to a higher level because, as you mentioned, many of them did not comply with the CDC requirements. And some protesters, demonstrators, only aim in life is to provoke the police. So we had to make sure that our officers were mindful and tolerant and poised and highly trained in de-escalation. I'm very proud to say that during my tenure, we have never had to arrest anybody during a demonstration or protest. That's not to say there wasn't some violation of the laws, because there has been some minor violations, but again, good discretion and de-escalation and just being tolerant and yielding to the individual's emotion of the moment. We have not had to arrest anyone. And the communities and the groups have responded in kind, but clearly during COVID, it's at an all-time high because we have to make sure we keep them safe and healthy while keeping the rest of our community safe and healthy. And of course, our first responders on the front line safe and healthy. So yeah, it's been quite a challenge.
Absolutely. And
Can I interrupt you?
Yes, please.
I want to express my profound gratitude and thanks and prayer to Chief Ron Haddad and every honorable police in this nation, for they are under a great deal of misunderstanding and pressure, and may God protect them and keep them safe as they protect us and keep us safe.
Here, Father, here.
Took the words
Thank
right
you,
out of
Imam.
my mouth.
Yeah.
Thank you, Father George, for that. And yes, we do want to give a salute to all our men in uniform who are out there risking their lives to ensure that there is safety and guidance for all of us.
Siam, may I add something else?
Please do.
We have a hadith that says, "Man lam yashkur al-makhluq, lam yashkur al-khaliq." If you want to be grateful to God, first be grateful to those who provide you with services. And
Yes.
the Islamic Center being so close to Chief Haddad, he's never shied away from supporting us in any shape or form during those difficult hours. So we constantly pray during the early phases for the police officers, for everybody else, but particularly the police officers, for looking after us and protecting us for all the things that we were going through. So I'm grateful to Chief Haddad and to his team.
Thank you both. Yes, I believe that, you know, it's important to recognize the fact that individuals have every right to show their positiveness or their negativeness and protest whatever they feel, but especially to the men in uniform who have to actually show the guidance and make sure that it's peaceful protest. So absolutely, thank you, and definitely we salute you. Father Shalhoub, I know that, and Rabbi Dorit touched a little bit upon this, but there has been so many funerals and so many people that we have had to bury within all communities all over the world. I've lost a few individuals that have been very near and dear to me, and was not able to attend and sort of have that closure. How are we dealing with that, and what happens when, you know, when somebody does lose a loved one, and emotionally speaking, I can't even imagine, you know, that sense of not having your community and family and friends with you. How has the church been dealing with that?
It was so hard in the beginning, not even visiting the dying person. So we began to say prayer for them on the iPhone, checking the nurse to bring the phone to their ear to say with them their last prayer, to communicate with their loved one. But the funeral we had, we've been blessed with a team of IT. And this team who knows IT and social media set up this, whether it's called Facebook or live streaming. So even though the all funeral were private, it was attended by the entire community. And so we kind of lean on each other by expressing the sympathy and love, since we cannot eat together, we will send food home to the grieving family. So the social media have played a great deal of advantage to lessen the loneliness and lessen the grief. And this way we begin to have a closure. Now, those who died 6 months ago, the family is now, as we open up a little bit at a time, they are able to come to church and to have a public memorial. And that is give them a great deal of pleasure and a closure too. And because it's so important to put a closure on your loved one, say goodbye. I had a judge who lost her mother. She was going crazy. Finally, I said, you need to have a memorial. And she came to church with her family and had a memorial, and everybody saw them. What we missed more than anything else, we are very huggable people. We hug, we kiss, we're very touchable. And but now at least we can have the eyes to hug. The eye, the mind, the heart can hug, a smile underneath that mask. So we manage it that way.
And that is so important too.
Utilizing the prayer through the social media. And I would always encourage every Sunday or every time we have an occasion to get together, that the family will gather their children and light their candle and say their prayer with us. At least the people who are at home, they don't feel alone. And also the team of this IT, we invented something called ministry in a minute. So in other words, we will create video of education, of encouragement, of counseling. They're 5 minutes, they're so short, and we will send it to the houses. And so the kids also see each other, they say their prayer, and they thank God that we are together. It is so
Absolutely.
important to be rooted. And when you are
Certainly.
rooted in faith, you overcome any tragedy.
Certainly, certainly, Dr. Shahub. On that note, also, Imam Kazaruni, in terms of the communities and the faith-based community and the constituents, the only way to get out of this is to get vaccinated. We all know that, and we hope that people are, open to that, and we hope that that is what, they're doing. But in regards to the overall theme, from what you're seeing, are people open to this? Are they getting vaccinated? Will we get to a point where everyone will be vaccinated, and things are opening up, and as Father Shalhoub said, the churches are opening up and people are being able to come in. So are there any things that are in place to make sure that people coming in without masks are vaccinated? Are they being checked, and also are the masks going to be still required?
Well, right from the beginning, we made even during the period that the center was closed, myself, I attended the center and communicated with people through phone, Zoom, and other social media outlets. But once we decided that during the second phase that the center is going to be open on a small activity, allowing certain group of people, the limit was set by the governor, and we made it conditional that people would call in advance, particularly for Friday prayer, call in advance and for reservation. But everybody, a member of the staff, one of the staff was at least available to make sure temperature, mask, and everything else that as people came in. We immediately separated the space that people stood for prayer, for congregational prayer. We communicated with grand scholars in various places to see what's the maximum distance and how we can navigate between the two requirements, the religious requirement and the political requirement, or the physician's requirement about social distancing. And we marked the carpets at the prayer hall so that people understood it, and made it clear that the people would adhere to them. One of the things that I had to adjust immediately was, as Father Shalhoub indicated, that we are, particularly after major prayers, we need to somehow reassure ourselves by hugging, kissing, and asking close contact. During this second phase, as soon as my prayer sermon was finished, I immediately would jump on the podium. Please don't hug, don't communicate, use the nearest exit to get out.
Hug with your eyes.
That created something new for the community. But the beginning of the third phase, as vaccines became available, suddenly we had a unique phenomena of what I call it conspiracy theorists spreading news within the community that these vaccines were created to control individuals, and somehow you have this kind of chips hidden in it, that if you were to have it, you will be controlled, and movement controlled. So there was an active effort by the center, by us, myself and others, to rest assure everybody that there was no such thing and there were no religious concern about it. And we took it even further, worked with the physicians and hospitals in our localities to turn the center into a center for free vaccines,
Right.
allowing people to come in, register and come in and get vaccinated without restriction of age or anything. While I went to downtown Detroit for my vaccines, people would come into the center simply, and the hospitals and physicians were extremely generous to
So,
provide
Imam,
us with the.
can I interrupt? So do you feel like individuals are more open to the vaccine
Yes.
now that they're more
Yes, now
educated
they are.
rather than before?
Yes, they are. Once there was conspiracy theory or concern was dealt with, then people began to come in, and we can see this through the number of calls that we receive on a regular basis. We started only Friday, now we have to add Monday to it as well. So people
That's
are coming
wonderful.
in, hopefully.
That's wonderful. Rabbi Dorit, within the Jewish community, was there a lot of pushback for the vaccine? What is the mentality now? And are people more open? Were those conspiracy theories sort of in that conversation as well, as I would assume in you know, all areas? I've heard some doozies, but we won't go there.
I have to say, for the most part, no. The Jewish community has always been very much in favor of health and doing what we could to advance medicine, and a couple synagogues also were open as sites for vaccine. In the very early phase, in fact, I was in charge of a drive where, you know, people couldn't get a hold of vaccines. So when Detroit opened up and said, if you can drive a senior or somebody who's eligible for a vaccine in Detroit, you can get a vaccine too. And I had close to 100 people who just called me and wanted to do that. So that was a matching thing. Although by the time we got to most people in Detroit, a lot of them had already gotten their vaccine. So, but people definitely, there was. Now I think the pushback is a little bit regarding the children, the very young children. They want to make sure that the vaccines have been tested enough before they give them to their children. But they're opening the summer camps, the Jewish summer camps already. The synagogues are starting to open on a limited basis, or not quite as far as Imam Kazaruni is with, and Father Shahu, but they're allowing, the Board of Rabbis agreed 36, which is a number of, in Judaism, that is a special number for the righteous. 36 people can come into a synagogue for a Shabbat or a life cycle event, and they might be changing that.
Wonderful, wonderful. I know that, you know, that's good to hear. The Jewish community is, you know, open, but I know the conspiracy theories were really globally. Everyone heard them. Everyone, you know, was affected by them, and you know, individuals who have a lot of concerns about that, you know, address those issues. And we had a lot of leadership that addressed it as well, but they were alive and well. And I hope through knowledge and communication, you know, that people across the globe, you know, have addressed it and are accepting of it. I do want to talk to Dr. Barlow about the mental capacity of everyone in regards to coming out of this pandemic. People are used to being alone. People are used to being a little bit more, you know, isolated, as we spoke at the top of the conversation. And it's going to be a challenge for people to get back into the routine, you know, of not working from home, of going into the office, possibly, of going to Sunday services, of you know, going shopping, of doing the things that we are used to. But, you know, as a creature of habit, we are now in the habit of not doing those things and getting things delivered. So what tools can you provide all of us, and suggestions to maybe, you know, change that sort of mentality? I know I will press the Amazon button before thinking of going out now, which
It's so easy. I get it.
And before this happened at all. I mean, that was something.
Absolutely.
So how do I change my mentality? How do I get back out there? How do I see people again?
I totally understand the anxiety behind it, but I do believe with vaccines, people are becoming a little bit more comfortable with doing gradually getting back out there, working and going shopping and things like that. I do understand where it's coming from. Let's validate those understandings and those fears and say, I get it, but what do we need to do to move forward? You know, I totally understand people still want to wear masks. Some places like Walmart and Target, they're saying, no, you don't have to wear a mask. If you feel comfortable continuously wearing masks, do it. Continuously do those things. But in my field, I do believe that if it's a continuous problem with you're having a problem getting out there and joining the world again, as for lack of better words, come in, let's have a talk about that. Seek a mental health professional. Let's discuss those anxieties one-on-one on a more individualized basis. Let's talk about that. What is the fear? What is that behind? And let's kind of work through those things.
Yes, absolutely. And it is about communicating
It
your
is.
fears, even if it's just to a family member, somebody that can listen, a friend, just to get it out there. So it is important, but we have to mentally sort of, restructure our brain to be able to accept, being out there again.
Kind of mentally decompress, basically. Say, let's reassess this situation. What are these fears rooted in? And, kind of go move forward from that.
Absolutely. And get out there, especially if you're vaccinated. And on that note, Chief Haddad, I know this may or may not be something that is being addressed within the police department, but is there any monitoring of violators who don't wear masks, who are not social distancing, especially with the new CDC guidelines? Chief Haddad, do you hear me? Chief Haddad, do you hear me? Are you there? I was just saying that I wanted to address the fact of people maybe not wearing masks, not adhering to the guidelines, and if there's a way that the violators are being addressed. But given these new CDC guidelines as well, it's been a little bit confusing. Do you wear a mask? Do you not wear a mask? I know what I'm going to do. I'm definitely wearing a mask whenever I'm inside, whenever I go into a store. So I hope everybody adheres to that, because we're still in that phase, that scary phase. So I'm vaccinated, but protecting others as well and protecting myself is important. But how is that going to be addressed with people that maybe not be vaccinated and wanting to go into a store, and the store saying, no, you have to wear a mask, or stores that say, no, you have to wear a mask, even though the CDC guidelines have changed? I see a bit of a conflict there. So is there a process to address that?
Well, first of all, we've tried to educate our community as much as humanly possible. And we put the bulletins out there in 3 languages to make sure they understand what's required. With the second part of your question, the stores have a right to tell you they want you to wear a mask. So they can do that. And people can either comply or choose not to come in. Third aspect, the problem is so vast that we can't possibly enforce our way to compliance. But in those cases where somebody puts somebody else at high risk, we do write tickets, but it's not going to help to have mass compliance in the community. So again, education is paramount. Here in the city of Dearborn, we went door to door, every single door. We left 10 masks on their door. We've given them out with the food drives every Saturday, 20, 30,000 masks per week. So I would just want to encourage people to take all the precautions. It's non-scientific, but it appears this past few months that it seemed like less people had colds around me anyway. And I don't know if we can quantify that, but so there has been some good, and that the normal flu season seems to have gone by us without much fanfare, if you will. But COVID certainly had a hold on us. So again, education, I would ask members of our community to just be responsible. It's about your health. We all like to take in the fresh air. We've been bottled up for over a year. Do it responsibly. And in those cases where they're truly reckless, the police will take appropriate action. But again, that's not the key to keeping our community healthy. The key is that we all do our fair share to look out for our loved ones and for our neighbors.
And honestly, the only way to do that is to continue to wear our masks and to get vaccinated. And we've had so much success with the vaccinations. I hope that people will adhere to that, and also with the children, 12 and over, because they are saying that it does affect them. So we need to be really cognizant of that. Imam Kazaruni, is there something that you would like to say to your congregation in regards to getting vaccinated, in regards to the importance, and in regards to just having faith and continuing the process?
Well, we took this, the idea of not only protecting oneself, but protecting others very seriously from the beginning. And we approached and communicated with a number of scholars to find out what are the religious obligations at these critical time. I was glad to hear that there was a unanimous and consensus between the religious scholars that we cannot do anything, not only to put ourselves at harm, but put others at harm as well. And we use that angle not only to encourage people to wear masks and go through the usual sanitization and everything else. Vaccination became part of that issue. That if you want to protect yourself, if you don't want to harm others, then vaccination will be another step within the steps that one has to take. So even these days, people that come to the center, they are reminded, whether it's for funeral or whether it's for prayers, they are reminded that they have to wear masks. I have a note in front of my office clearly states, no mask, no service. So
I like it.
Yes, it's everybody knows about this, that if they come in and they say, well, we have been vaccinated, I would remind them that so have I, but I would like everyone to wear masks because we don't want to put anybody else at risk. So this is the approach that we have taken, and thank God it's been working and people have been responding, although there are some elements that they come in and they try to find various excuses not to wear masks. If I see anybody, they come in, they have a mask, and then if they go into the prayer hall and they want to remove it or they don't have it, I immediately remind them that, or ask somebody to bring a mask for them. So we have to be very careful and diligent that this is a serious issue. Until we are confident that we have seen the back of it, we can't drop our guards.
Certainly. Rabbi Dorit, I would address the same thing to you. What kind of mandates, continuation of masks, social distancing within your community?
Yes, definitely. We're trying very much to set up a consistent protocol for all the synagogues, so also that people won't start saying, well, they do it this way at this place and this way at the others. So that is extremely important. Also because we have a lot of life cycle events with weddings and bar and bat mitzvahs and stuff coming up now in the summertime. My own congregation, I have one in Bay City. I have a little bit of a war going on there because there are a whole group that didn't want to come to this Zoom. They said they're zoomed out. They'll only come back when we can get into the synagogue. I said, well, okay, in the fall we can do that for the high holidays, but we have to have protocols where people definitely have to be vaccinated, definitely have to wear masks, definitely have to have their temperature checked. And then I've heard, well, there's some that are going to refuse to wear a mask, but you know what? They refuse. They're just going to have to be greeted by the security guard at the front and said, these are the rules, and this is for the sake of everyone's health here, and please comply. And I think, it will take us at least another year before everyone is fully vaccinated, children included. And I strongly encourage people to do that because, as Imam Kazaruni said, this is a matter of life and death.
Absolutely. And you know, they talk about herd immunity, but I would just hope that people would get vaccinated and protect themselves that way, because we don't want to lose any more people to this horrid disease. Father Shalhoub, I'm gonna go to you. Always inspirational words. You know, how are we ensuring the safety of everyone, and what's the message there, and how are you going to continue this process when things do open up at the church?
I think throughout this pandemic, there's not one time that I gave a sermon, but I brought in the issue of Corona and insert in it a message of hope, a message of victory, a message that we shall defeat it. And I think the education from the pulpit, it's so essential. When I tell the people I am vaccinated, and if vaccination is good for the priest and the imam and their family, is good for the public. One time, a person brought this conspiracy theory. I said, what good it is if we all die and you will be alone? What kind of life you live? They says, you know, Jannah bala nas ma btindafs. So I said, you know, don't save it. So by education and little at a time, you always find people who are a little bit odd, and especially community of faith attract a lot of odd people. You know, they
Tell
feel
me about it,
comfortable.
Father Shalhoub.
we're sometimes we're all odd. So you have to be patient with them. Don't attack them. And little at a time, they all fall into the program. So I think love, they said love is patient, love is kind, and love never impose. But we need to always run a good and clean temple and mosque and churches to be a good example to others. So we're going toward that end, and we're working toward this opening. So I thank you. I thank the panel from all my heart, because I do miss everyone. And I hope soon we shall come together and celebrate life all over again. And maybe for all of us, this pandemic to teach us to be better people.
I think that's the
Better
hope.
people, better
That's the hope, Father
friends,
Shalhoub.
better spouses, better brother and sister. God bless you, honey. Thank you.
Absolutely. I do want to go to Dr. Barlow before we end. Dr. Barlow, you know, this whole conversation in terms of being vaccinated and not vaccinated, and so many individuals lost their loved ones, were not able to go to the hospitals to see them. The nursing homes, you know, the isolation of the elderly, how has that affected people, and that lack of connectivity? How are we going to get out of that mode and sort of, you know, bring that back? And also the individuals who did lose people that they weren't able to see or say goodbye to.
Absolutely. It has affected all of us. Those are normal rituals, being able to be with your loved one during sickness and illness, and then the funerals, not being able to participate in that. That is part of our rituals that we all enjoy, that we are not enjoy, but we all participate in as kind of a closure. We all are suffering from a sense of not having closure. There's so much uncertainty, which causes a lot of anxiety. So all of those things need to be addressed, and how to have taking care of ourselves. That's important. Self-care. Let's not forget about self-care during this whole pandemic. That's important, to take care of ourselves, eating properly, exercising, things that we can do. Thinking about things like that. How do we move forward? We take care of ourselves. We do connect through Zoom and telephone calls, as the rabbi stated. What can we do to kind of still connect with loved ones during this time? Being vaccinated. If there's a concern about vaccination, let's address that anxiety. Where is that coming from? These are all wonderful approaches to kind of get past this time of our life.
Certainly. And I hope people do reach out when they're feeling anxious or they're feeling a little bit lost in regards to moving forward and trying to get back to some kind of normalcy, reaching out with those anxiety and knowing that I think all of us, you know, have those things.
Absolutely.
I think our time is up, but I want to thank you, Imam Ibrahim Kazaruni, Father George
Thank
Shalhoub,
you.
Dr. Barlow, Rabbi Dorit Edut, and of course, our beloved Dearborn Chief of Police Ron Haddad, and also the men and women of the services and law enforcement. So definitely we salute all of them. And this has been an inspirational, informative discussion. We thank you for being with us and taking time to share your challenges and triumphs in a time that's affected all of us in a unique and an individual way. Thank you all for joining us today, and hope that you've taken away some valuable information that will assist you in making the right choices for you, your family, and your community. We really are all in this together, and the safety of all of us relies on the safety of each and every one of us. We must take this seriously and work together so that we can eradicate the virus. We are on this cusp of getting back to some kind of normalcy. It's time we hug our families and see our loved ones. We're almost there. Although things are opening up, we need to remain vigilant and we need to be careful. Let's collectively make that happen by continuing to wear our masks while indoors, social distancing, and get that vaccine for the protection of all. Thank you to our partners, Access, the DMC, and to the Dearborn Lions Club team who worked diligently once again to present to you this vital information during this continuing pandemic. I'm a proud member of the Lions Club and encourage everyone who wants to serve their community in a meaningful way to consider joining the Lions Club in Dearborn or in your community. It's certainly a worthwhile organization. And thank you, President Lion Ali Ali and Lion Fatmi Mustafa, for the dedication to this presentation, and to the entire Lions Club members who give of themselves daily. And thank you to our panelists once again who make this happen, and for invaluable information to our communities, our constituents, and everyone involved in this. I think the global community has gotten a lot smaller. We're really all one family, and we're all dealing with this together on one platform. And we hope for peace, love, commitment, and protection, and taking care of all of us together. God bless. Have a
Thank you
wonderful
very much.
evening.
Thank you.
And it was all wonderful to see all of you again. God bless.
It's our pleasure. Thank you.
Shalom
Bye-bye.
and salam to everyone.
Shalom,
Thank
salam.
you.
Allah ma'akum. Bye-bye. God be with you.
Ma salam.
Allah ma'akum.